The WHO officially declared COVID-19 a pandemic as the virus continues to spread rapidly around the world. Already more than 110 countries have reported confirmed cases. Hyeong-woo has our top story.
With over 110,000 confirmed cases reported in at least 110 countries across the globe, the World Health Organization has officially declared COVID-19 as a pandemic.
And we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
The WHO leader added that he expects to see the number of cases of death in affected countries to increase over the coming days and weeks. On the last day of 2019, 27 cases of pneumonia were reported in the Chinese city of Wuhan. 10 days later, Wuhan announced the outbreak of a novel coronavirus along with its first death. Over the course of the week that followed, countries including South Korea and the US reported their first confirmed cases. Things escalated fast from there. The WHO declared a public health emergency of international concern on January 30th. Fast forward around 40 days, and at least 100,000 confirmed cases with 3,500 deaths in over 100 countries have been reported, eventually leading to COVID-19 being declared as a pandemic. This urges governments to initiate preventive and emergency measures to protect the public, including more stringent travel and/or trade restrictions. But the WHO said, calling the virus a pandemic does not change what it has been doing, calling on countries to take urgent and aggressive action to curb the spread of the virus.
I remind all countries that we're calling on you to activate and scale up your emergency response mechanisms.
The WHO leader emphasized that the virus can be suppressed and controlled even with community transmissions or large cluster infections like those in South Korea and China. Hyeong-woo, Arirang News.